I want you to imagine this. Your stomach suddenly cramping up right before an important meeting, or even an exam. You feel bloated, like you've just swallowed a balloon. You rush to the bathroom again, not sure if it's going to be diarrhea or nothing will happen at all. Does this sound familiar? If it does, you are not alone. Millions of people around the world deal with this every day. It's called Irritable Bowel Syndrome, or IBS for short. Today, I'm going to be explaining exactly what IBS is in simple words so that you can understand it clearly whether you're living with it or learning about it. Let's start with the basics. Your digestive system is like a long tube that food travels through. It breaks down what you eat, absorbs nutrients, and gets rid of waste. Normally, muscles in your intestines squeeze in a smooth, coordinated way to move everything along. But in IBS, something goes wrong with that coordination. IBS is a common disorder that affects the large intestines, also known as the colon. It is not a disease that damages your gut. There is no inflammation, no ulcers, and no increase of serious problems like colon cancer. Doctors call it a functional disorder. That means the gut looks completely normal on tests, no scars, no infections, but it just doesn't work quite right. So what exactly happens? The muscles in your intestines might squeeze too hard or too weakly, or your brain and gut might be extra sensitive to normal signals, like gas or stretching, turning small things into big discomfort. The main symptoms are abdominal pain and cramping, which is usually in the lower belly, bloating, which is that full, tight feeling like your stomach is swollen, and changes in your poop. It could be diarrhea, it could be constipation, or alternating between both. Also excess gas, and sometimes there can be even mucus in your stool. These symptoms have to happen at least once a week for at least 3 months, and the pain has to be connected to your bowel habits for doctors to diagnose IBS. There are a few types of IBS. IBS with constipation, also known as IBS-C, IBS with diarrhea, also known as IBS-D, and IBS mixed, which is both constipation and diarrhea, which is also known as IBS-M. Why does IBS happen? We don't know exactly the cause, but several things can play a role. First, the gut-brain connection. Your intestines has their own nervous system, sometimes called the second brain. Stress, anxiety, or strong emotions can make the gut overreact. Second, some people have extra sensitive nerves in their intestines. Normal amounts of gas or movement feel painful. This is called visceral hypersensitivity. Third, changes in gut bacteria. The trillions of microbes that live in your intestines might also contribute. Past infections like bad stomach bugs can sometimes trigger IBS. Food sensitivities, hormones, many women notice worse symptoms around their period, and even genetics can be factors. The important thing to know is that IBS is real. It's not all in your head, even though some stress can make it worse, and it's very common. About 10 to 15% of adults worldwide have this. It can start at any age, but often begins in the teens or early adulthood. Women are diagnosed more often than men. So we've discussed what IBS is. Let's discuss what IBS is not for a moment. IBS is not inflammatory bowel disease like Crohn's or ulcerative colitis. Those cause actual damage that you can see on examination, tests, and screenings. It's not celiac disease or lactose intolerance, though they can be sometimes cause similar symptoms. And finally, as we said before, it is not cancer. Doctors diagnose IBS by listening to your symptoms and ruling out other conditions with tests like blood work, stool tests, or sometimes even a colonoscopy, especially if there are warning signs like weight loss, bleeding, or symptoms starting after the age of 50. The great news is that IBS doesn't shorten your life, and most people that have IBS manage it very well with lifestyle changes, diet adjustments, stress management, and sometimes medication. If you have IBS, you are not imagining it, and you're definitely not alone. Understanding what it is, a miscommunication between your gut and your brain leading to uncomfortable but harmless symptoms, is the first step towards feeling better. Thank you for listening. If you have any questions or want to learn about ways to manage symptoms, I'm happy to help. Take care of yourself. Your gut will thank you.